In fact, has some more breaking news coming in. Indore District Magistrate Shivam Verma has now spoken on the deaths in the city due to contaminated water. He stated that as per the orders of the Chief Minister, those who fell ill are being given treatment, with around 149 people admitted to the hospital. He also revealed that a survey team is currently going door to door with 2,700 houses surveyed so far. Listen into what he said.
देखिए, ये जो दुखद घटना हुई है, इसमें दूषित पानी पीने से जो इतने संख्या में बड़ी संख्या में बीमार हुए हैं लोग और 4 लोग की इसमें दुखद मृत्यु हुई है। इसको संज्ञान में लेते हुए माननीय मुख्यमंत्री जी के निर्देश पर निरंतर जो पीड़ित है उनका उपचार किया जा रहा है। लगभग 149 लोग अभी वर्तमान में हमारे एडमिट हैं जिनका उपचार किया जा रहा है और हमारी सर्वे टीम भी घर घर जाकर इसमें सर्वे भी कर रही है। 2700 घरों का सर्वे कल रात तक कंप्लीट किया गया था और जिसमें ऐसे कोई भी व्यक्ति जिनका सिम्टम मिला है उनको तत्काल हमने ट्रीटमेंट में लिया है, उनका ट्रीटमेंट किया जा रहा है। प्लस आज एहतियात के तौर पर जो लगे हुए एरिया और हैं जैसे परदेसीपुरा है, शीतल नगर है, तो वहां भी हमारी सर्वे टीम घर घर जाकर जांच कर रही है। हमारी एएनएम आशा कार्यकर्ता इसकी डोर टू डोर जाके काम कर रही हैं और यदि उन सभी जगह पे ओआरएस की किट भी वो डिस्ट्रीब्यूट कर रही हैं और यदि कोई ऐसा सिम्टोमेटिक पेशेंट लगता है जहां पर जिसको अटेंशन की जरूरत है उनको हम लोग एडमिट भी कर रहे हैं। देखिए,
All right, so that's a statement that has been issued by the Indore DM. Dr. Girada continues to be with us on the broadcast. Dr. Girada, we've heard what the DM has to say. There are surveys that are taking place from door to door. 149 patients are currently being treated. But the fact of the matter is, all of this is happening after the death of 8 people and the hospitalization of 150 people, who perhaps should then take accountability, because like I started, when I started, I said that this is not about, you know, right to breathing fresh air, it's not about right to drinking safe and clean water, it's about right to life. Who should take accountability so that this, you know, we can just nip something like this in the bud?
Asawari, we are in an era of science. Whatever you have been speaking in all over the media, it is there. None of the media says what is the infection. And it is a 10 minutes job. You just examine stool of those infected people, whether children or adult. Find out whether it is a bacterial infection, viral infection, parasitic infection. What is that infection? So if you are able to pinpoint 1 or 2 children or 1 or 2 adults that they are having this infection, that means that infection is there in that water. Secondly, even if you don't want to test human being, test water. In water also you can test what are the infections available. Secondly, chlorinating the water, boiling the water. Simple 2 drop of your household bleach in 1 liter of water is good enough to kill lot of infections. So I think these scientific things are ignored. We are just talking about crime, having some cases, culpable homicide, suspending people. I think we do not understand the human life, and we do not understand how those children can be kept alive if they are dying at 6-month age. So I think the total humanitarian aspect, medical aspect, scientific aspect, health aspect, they are ignored. We are talking beating around the bush. So I think we should first evaluate what are those infections. If the people are dying, 147 are sick, so many people are, what is the infection? It doesn't take more than 10 or 15 minutes to diagnose that. So let us focus on that. Once you focus, then solution is easy. Otherwise, we will be just discussing, some more children will be dying, some more adults will be dying, and we'll just have a statistics, how many people are dying and how many people are getting sick. So I think our focus is going away from main issue, and we should not politicalize. We should stop this VIP tourism. We should look at, appeal people not to drink that water. If you are really very keen, provide them clean potable water, maybe RO water, or that is the best way to help people. And find out what is the source of infection. Whether there is a drainage line going in there, whether there is a sewage line going there, what is happening? There has to be some reason. So on one hand, you find out the public health reason from municipal corporation. On the other hand, look at the human beings. Human beings are very precious, very important. Just giving them 2 lakh, 3 lakh, 5 lakh is not a service to any human being. Yes, it is for the time being, it helps, but it also creates a sense of dependence on government and authorities that if somebody dies, okay, we'll get 5 lakhs. Please don't do that. Don't, about 10, 15 years ago, they used to give 5,000, now it has come to 5 lakh. But it is a solution.
Right, absolutely. So with that, I'd like to thank you for joining us on the broadcast. You've taken a very, very important conversation with us on NewsX, and we will continue to focus on this, to get the details and hopefully to nip it in the bud. Thank you for watching.